So randomized controlled trials are intended to take, in general, two groups, make them relatively similar, put them through a trial, and then see what drops out. And the matching of those populations often allows that question to be asked as an essence between those two groups. But once you take that group and you compare them to a general population or one that's slightly different, then those things fall apart. And we see that now in vaccine trials where the cohorts are very different from vaccine to vaccine, so you simply can't compare percentages of efficacy from one to the other, but because the patients are different. And that's true in atherectomy, that's true in TIPS, that's true in most endovascular therapy and even pharma trials as well. So they have to be done again and again and again, and then pooled. So pooling is a meta-analysis. And when you have excellent individual trials that are relatively similar, then signal can come out. And that's a beautiful essence. But when those trials are messy or limited in their scope or have intrinsic bias, and essentially we're pooling something that becomes a bit more of a sludge. And that's what's been found, that as many as 3 out of 4 meta-analyses that have been published or systematic reviews are subject to significant bias, which is that old 1960s computer phrase of garbage in, garbage out.